Good morning, everybody. Thank you for joining us for this training. This is a pre-recorded training. Before you started watching this, you should have already completed your pre-test that I emailed you a link to. Once you are finished watching this recording, then just email me at cfrensley@ucphuntsville.org and let me know that you completed watching it, and I will send you the link to complete the post test. And by completing the post test, that's how I know you have completed this, and that is what could allow you to be eligible for a education stipend for watching this. So be sure to let me know when you finish this. But today's training is going to be talking about preserving physical and psychological health. We are actually going to watch some videos that are going to put us in scenarios of learning to maintain professionalism while, advocating for safe treatment for older adults. Is going to show us some intervention and de-escalation tactics in caregiving scenarios. We're going to learn a little bit about, like I said, preserving physical and psychological health for older adults, such as your care recipient and the caregiver. We're going to identify best practices for supporting older adults with a history of trauma by embodying a veteran with PTSD and seeing the warning signs and risks associated with compassion fatigue and caregiver burnout. So, what we're doing today is going to be very exciting. And is going to be watching a few videos, and each video will be in 3 different segments, and through each one we will talk a little bit about it. So I will go ahead and get right into it. Okay, so sorry that froze up for a second, but what we have here is, like I said, an overview of the modules we're about to watch. Is all about elder safety and well-being. This lab focuses on preserving physical and psychological health for older adults and their caregivers. Learn to maintain professionalism while assertively advocating for safe treatment for older adults in intervention and de-escalation. Identify best practices for supporting older adults with a history of trauma by embodying a veteran with PTSD, and see the warning signs and risks associated with compassion fatigue and caregiver burnout. So this first experience we're going to watch is only 7 minutes long, and it's going to highlight caregiver burnout. So it should be very interesting. So in this one, we're going to observe warning signs of burnout, experience negative drug interactions, and identify associated risks and preventative self-care measures. We'll learn about identifying dangers of caregiver burnout, such as medication errors, care plan violations, shortcuts, irritability, lack of patience, and impaired decision-making. We will learn about engaging elders in meaningful activities to enhance quality of life and reduce behavioral manifestations. We will learn about identifying community resources to support informal caregivers and keep elders safely at home. So in this one, we will be Hazel. Hazel is a vibrant 75-year-old who thrives on her relationships with others. She enjoys singing at church, playing bridge, and volunteering in her community. Due to her degenerative joint disease, Hazel can no longer walk into town or safely climb stairs. Last year, she moved in with her daughter, Kathy, who has a first floor bed and bath. About 6 months ago, Kathy began noticing some changes in Hazel's recognition, but Hazel seems unaware of any deficits. Who you'll meet in this is Kathy, who's Hazel's daughter and the mother of Lucas and Lily, 9-year-old twins. She's a single mom who struggles to balance demands of work and family. She has always been an overachiever and does not accept help easily. You'll meet Lucas, like I mentioned, who's Kathy's 9-year-old grandson. And then you will meet Karen, who is Hazel's home health aide. So we'll get right into it. Well, looks like we're having a little bit of trouble here, but let's see if we can get it going. Oh, here we go.
Is everything ready for this afternoon, Nancy? Is everything ready for this afternoon, Nancy? Great. And could you reschedule this morning's meeting with Joe? Yeah, okay. Hang on a second. Go tell your sister it's time for breakfast.
Lily, time for breakfast.
So what you're seeing here is the view through Hazel's eyes. So keep that in mind. We are viewing out of Hazel's body. So we're looking at Lucas right now, and Kathy is the one speaking.
Lucas, go tell her quietly. And get ready for school while you're at it. Sorry, Nancy, where was I? Oh, right, yeah. Okay, I will email it to you later this afternoon.
It's a dinosaur attack.
Hey, honey, I'm on the phone. Did you take your meds, Mom? Good, you did. Okay, right, okay, I'll email it to you, and then can you make 10 copies for the stakeholders?
Oh no.
Okay, great. Lily, breakfast!
Lily, breakfast.
Okay, Nancy, I gotta go.
Mom, I need $5 to the field trip today.
Why do you tell me these things at the last minute? I don't even think I have any cash. I don't have any cash. Stop playing with that and eat. Oh, careful, Ma!
I'm sorry. I can clean it up.
No, don't move.
It's just a little juice, honey. Don't get so upset.
Yeah.
My presentation notes are ruined. The laptop's all sticky, and now I've got to get you cleaned up again. I don't have time for this.
What about my field trip money?
We'll stop by the ATM and drop it off for you at school. Now go, go, go! Lily, time!
Okay, so I think we're having a little internet issue, so give me just a second. Okay, so let's try this again.
Is everything ready for this afternoon, Nancy? Great. And could you reschedule this morning's meeting with Joe?
Okay, sorry guys, it looks like we're having to start from the beginning, but you could probably in this YouTube video be able to fast forward through, so you may just want to fast forward until you get to where we left off the last time.
Yeah, okay. Hang on a second. Go tell your sister it's time for breakfast.
Lily, time for breakfast!
Lucas, go tell her quietly. And get ready for school while you're at it. Sorry, Nancy, where was I? Oh, right, yeah. Okay, I will email it to you later this afternoon.
It's a dinosaur
Quiet,
time!
honey, I'm on the phone. Did you take your meds, Mom? Good, you did. Okay. Okay, right, okay, I'll email it to you, and then can you make 10 copies for the stakeholders?
Oh no.
Okay, great. Lily, breakfast!
Lily, breakfast!
Okay, Nancy, I gotta go.
Mom, I need $5 to the field trip today.
Why do you tell me these things at the last minute? I don't even think I have any cash. I don't have any cash. Stop. Oh, careful, Ma!
I'm sorry. I can clean it up.
No, don't move.
It's just a little juice, honey. Don't get so upset.
Yeah.
My presentation notes are ruined. The laptop's all sticky, and now I've got to get you cleaned up again. I don't have time for this.
What about my field trip money?
We'll stop by the ATM and drop it off for you at school. Now go, go, go! Lily, time!
So in that, I don't think it's going to let us go past that scenario, but in that we see how low and impatient the caregiver is. She's being explosive to her mom, she's being explosive to her children, she's clearly overworked, and she just needs to slow down and take a breath. Maybe delegate some responsibilities to, now and later. Her fuse is very short, we can see. So we will get into the next one. And it's going to highlight a different scenario. And this one is going to be about intervention and de-escalation. So like I said, this one we will observe abusive situations, determine how to keep elders safe, and experience confrontations with family members and coworkers. We will learn about successfully diffusing tense situations and redirecting elders using effective communication and active listening skills. We will learn about gaining confidence and initiating difficult conversations with family and coworkers to advocate for elder safety. And we will learn about understanding the personal role in preventing, reporting suspected and known abuse. So we will see Abby in this one. This is a different scenario with different people. Abby is a seasoned nurse's aide and a confident elder advocate who is passionate about empowering the individuals she serves. She is a team leader and enjoys mentoring new staff members. We'll meet Eloise is in her mid-70s and has mid-stage Alzheimer's. She has high anxiety and language deficits due to progressive aphasia. She often refuses care and believes she is neat and clean even when she is not. Eloise startles easily and freezes when she's afraid. Triggers include loud noises, people invading her personal space, and raised voices. We'll meet Jennifer. Jennifer is Eloise's daughter. She works a high stress job and visits more out of obligation than desire. Jennifer is harsh and almost malicious in dealings with her mom, does not understand dementia at all, and thinks her mom is being difficult on purpose. She frequently complains about her mom's appearance and is intimidating to staff. And then we'll meet Hector. Hector is a new CNA being trained by Abby. He recently completed abuse prevention training and is eager to do the right thing. Today is his first experience with a potentially abusive situation. Hopefully this one will play a little bit better.
Mom, please, stop being so difficult. I don't know why those aides listen to you and let you get away without taking a shower. Oh, God, your hair. You look like some sort of bag lady.
No! Don't touch me.
Oh, thank goodness, there you are. My mother's hair is filthy, and she doesn't quite smell like a rose. Mother, I'm getting you into the shower today, whether you like it or not. Would you give me a hand? Let's get her into the bathroom.
You know what? Why don't I just make an appointment for her at the beauty shop? Would you like that, Eloise?
And charge me even more money? No, thank you. This place has bled me dry already. And just forget about it. She's my mother. I can handle it. Mother, I'm going to get you into the shower today and get you cleaned up if it's the last thing I do. And you can like it or you can just lump it.
I think we should leave your mother be for today. I know you mean well, but if she doesn't want a hair wash, it would be abusive to force her.
Abusive? Are you calling me abusive? You're the one that's neglecting her. Ugh. I'm gonna call the Department of Health on this place. Just get out of here. I can handle this and take care of my mother myself.
Of course. But could you just step out with me into the hall for a moment? There's something I'd like to discuss with you in private.
What? Ugh, fine. I'll be right back.
Your mother has been having a difficult day, and she woke up this morning.
I don't have time to listen to your excuses.
Fine, but I'm calling security to have you removed for Eloise's safety. And I'm going to need to talk to you about the way you treat your mother.
Are you kidding me?
Oh, I bet you're just loving this. What are you saying when I'm not here? Are you telling stories? Just you wait, Mom. I have power of attorney.
Hector,
Healthcare
call security.
Watch what you
Okay.
say.
Sometimes it's hard to know when a situation is abusive or not. Abuse can come from anyone, a stranger, a family member, even a colleague. Which is not to say that we need to be paranoid and look for abuse everywhere, but it is up to us to be vigilant. Let's take an example. You walk into an elder's room and you find that a colleague has placed them in a recliner and put a trash can under the foot. Do you think that's okay? Go ahead, Hector.
No, it's considered to be restraint, and it's a care plan violation.
Exactly. Not only that, if the elder falls climbing out of the chair, it escalates to a physical abuse incident. I'd like you all to take a look at these examples and determine whether they are a form of abuse or not.
Okay, so which of these do we think would be classified as abuse? Administering a behavior modifying medication as ordered by a physician. So I don't think that's abuse because it was ordered by a physician. What about continuing to perform care after an elder tells you to stop? I think that is abuse. What about withholding dessert from an elder until they finish their dinner? That can be a form of abuse. Speaking to an elder as if they were a child. It really just depends on the scenario. So I don't know about that one. And then we'll see a family member spending the elder's tax return. That is definitely abuse. Refusing to give thin liquids to someone with an order for thickened liquids, definitely abuse. Ignoring or giving the silent treatment, abuse. Physically holding an elder down to prevent a fall. I'm not sure about that one. So in that one, we definitely seen some caregiver abuse in that scenario. That caregiver was just very explosive, very ugly with her mother, not treating her with compassion, being combative with the caseworker. All that's just not good. So let's go to the next scenario and see what is about to happen. So this is the last one, and this one is going to be about experiencing PTSD flashbacks and associated anxiety symptoms, as well as identifying common triggers and self-regulating practices. We'll learn about gaining empathy and understanding of PTSD and identifying common triggers. We'll learn about using positive approach tactics to safely and effectively support older adults experiencing PTSD flashbacks. And we'll learn about promoting self-regulation techniques such as deep breathing, guided meditation, and environmental adjustments. In this one, we will be Harold, who's a retired soldier living with PTSD in a trauma-informed community. PTSD triggers include people screaming, crying, loud banging noises, crowded, congested areas, the smell of rice cooking, and fireworks. Harold is proud to have served, but embarrassed in private about his PTSD. He is frustrated that he's still affected after all these years. And Harold is a trivia buff and enjoys many pleasures like fresh air and a good cup of coffee. In this, we'll meet Melanie, who's a seasoned nurse's aide with a clear understanding of PTSD and experiencing providing trauma-informed care. She is warm and compassionate and well-loved by staff and residents. We'll also meet Karen, who's a nurse's aide with institutional experience who is still learning about PTSD. This is the first trauma-informed community she has worked in, and she is eager to make a difference. And then lastly, we'll meet Ken, who's the nurse manager and also a veteran. He enjoys spending time one-on-one with all of his residents and building meaningful relationships. He has a smile to share.
N42. N42. Huh? Okay. All right. Here. I-17. I-17.
No! No! Stop it! Stop it! No!
Yeah, it's okay, Harold. I'll be right back. Okay?
We don't hit.
I didn't mean to.
I'm taking you to your room until you calm down.
No.
There. That will keep you where you can't do anyone any more harm. You okay?
Yeah, I'm good. Thanks.
Hey, are you okay?
Oh, I'm fine, Harold. I shouldn't have touched your arm during a flashback. Harold used to be in the armed forces.
Yes, ma'am, that's me. Career soldier. Served my final tour in the Gulf War. Iraq.
And we're so grateful that you did. Even if it comes back to haunt you sometimes. Now, let's get these brakes off of your wheelchair, okay?
Mm-hmm.
All right. Here you go. Well, we'll see you later, Harold.
All right, bye-bye.
Can I just talk to you for a minute? Okay. Look, I know you meant well, but you can't just put him in his room with the wheelchair brakes on. That's considered seclusion and restraint, and not to mention, it escalates his anxiety.
But he hit you. Aren't you mad?
No, not at all. Harold's about the sweetest man you can imagine. I should have gotten his attention before I entered his personal space. He has a really long history with PTSD. But there are some new things that we can try for next time that might help him gain some control over these
No! Oh, no! Help! Help!
Harold. Everything's okay. You're right there. Everything's okay. It's okay. It's okay. Take a deep breath. Take a deep breath. I have some new techniques that will help you calm down today. What do you want to try? Earplugs or a breathing exercise?
I don't know. Just help. Make it stop. Make it stop.
So, I saw you had an interesting week. What would you like to tell me about first?
I hit Melanie this week during one of my episodes. I'm so ashamed of myself. Melanie is one of my favorite people here. Why can't I control this thing?
So, I saw what happened. try not to let it bother you too much. That's the advantage of living in a place like this, where the staff is trained to understand and support people who are going through what you are. They just take it in stride.
I have been sleeping a lot better this week. They gave me some earplugs. I've been wearing them to bed. Now every little noise is not giving me nightmares anymore.
That's great, Harold. You know, managing your physical environment is a great way to feel more in control of your people.
You know, I really do like living here. The staff, they all get me, you know? I'm not just that guy with PTSD. I'm a father, I'm a husband. I take my coffee black, you know, I'm a whiz at trivia. They don't judge me when I have flashbacks. They don't look at me like I'm crazy. Feels good.
Speaking of which, I've got a new trivia question just for you. What was the oldest case of PTSD in history?
Easy. First World War, right?
Nope. The oldest case is from the Epic of Gilgamesh, written in, wait for it, 2100 BC.
No way. PTSD is that old?
Yep. And I can't believe I managed to stomp you. That's the first.
Yeah. You got me.
So the scenario with Harold is really sad with his PTSD, but as we can see, he's in a really good community for him where there's people trained to navigate his symptoms and outbursts and help him de-escalate. And that's all he could really ask for, you know, somewhere to be where he's understood and people know how to handle PTSD. So through all these, we've seen 3 different scenarios and we've learned a lot from each one. I know the internet was a little bit choppy, so thank y'all for bearing with me through this. But I hope you learned a little bit through it. We do have different modules like this, so if you would be interested in seeing a few more that are like specific to a diagnosis or another scenario, feel free to email me and let me know and I can set that up. But this was very interesting and I hope y'all enjoyed it as much as I have. Don't forget to always take advantage of our online trainings. Be sure to email me after this so I can send you the post test. And if y'all need anything, feel free to call the office or email me. We're always here to help you in any way. But I hope y'all have a great rest of your day. And if you need anything, feel free to let us know. Thank y'all.